What are the best H. pylori tests for stomach cancer? Imagine catching a silent threat early before it becomes serious. That's what testing for Helicobacter pylori, or H. pylori, is all about. Since H. pylori infection is a major risk factor for developing stomach cancer, accurate detection is key. There are both non-invasive and invasive tests that help doctors find out if you have this bacteria and assess your risk for stomach issues. The most common non-invasive tests include the urea breath test. This test is simple and highly accurate. You drink a special solution containing urea, and if H. pylori is present, it breaks down the urea and releases labeled carbon dioxide, which you breathe out. The machine measures this to confirm an infection. It's quick, painless, and useful for initial diagnosis or checking if treatment worked. Then there's the stool antigen test. This involves analyzing a stool sample to detect H. pylori antigens, which are proteins from the bacteria. It's also reliable and can be used for diagnosis or to see if the infection has cleared after treatment. Blood tests that look for antibodies are less preferred because they can't tell if the infection is current or in the past. They might be used for screening in some cases but are not the best for confirming active infection. When more detailed information is needed, especially if there's concern about precancerous changes, doctors may recommend invasive tests during an endoscopy. During this procedure, a thin tube with a camera is inserted into your stomach. A small tissue sample or biopsy is taken. The rapid urease test is performed on this tissue. It checks for the enzyme urease, which H. pylori produces. If the enzyme is active, the test is positive, confirming infection quickly. Histological examination involves looking at the tissue under a microscope to see if H. pylori is present and to check for changes in the stomach lining that might lead to cancer. Molecular tests, like polymerase chain reaction, detect H. pylori DNA in the biopsy sample. These are very sensitive and can also identify if the bacteria are resistant to antibiotics, which helps guide treatment. Culturing the bacteria from the biopsy is another option. It allows for testing which antibiotics will work best if treatment is needed. Assessing the risk of stomach cancer involves more than just detecting H. pylori. During endoscopy, doctors may use advanced imaging techniques to look for precancerous lesions. They also evaluate the severity of gastritis or stomach inflammation, using scoring systems like the Kyoto classification. This helps determine how likely it is that the infection could lead to cancer. In summary, the best approach combines non-invasive tests like the urea breath test and stool antigen test for initial detection and follow-up. If infection is confirmed, especially in high-risk cases, invasive tests during endoscopy provide detailed information about the bacteria and the condition of your stomach lining. Early detection and treatment of H. pylori can significantly reduce the risk of developing stomach cancer. Always consult with a healthcare professional for personalized advice and testing options tailored to your health needs.